Welcome back to Northwestern Buffett's weekly webinar, bringing expertise from around our campus and around the world to bear on the COVID-19 crisis. This week, we are going to look into the effects of worldwide social distancing and shelter-in-place mandates on our everyday lives and our social practices. So today, delighted to have with us two eminent scholars who will help us think about the effects of social distancing on our psychological well-being, our personal behaviors, and our political tendencies, and tell us what to do about it. So first, I'm delighted to introduce my colleague, Northwestern University Professor of Political Science, Dr. Jamie Druckman. Jamie is an expert on political science, on the politics and science of communication, and Jamie's is currently studying how citizens make political, economic, and social decisions in various contexts, particularly in settings with multiple competing messages. And Jamie is joined by his research collaborator and colleague, University of Cambridge social psychology professor and director of the Cambridge Social Decision Making Lab, Dr. Sander van der Linden. Welcome, Sander. Sander's research focuses on the psychology of human judgment, including social norms and networks, reasoning about evidence, and public understandings of risk and uncertainty. And he's especially interested in how people form misperceptions and how those misperceptions shape collective action. So today, Jamie's going to first share with us the findings of a report that he and Sander co-authored, along with 24 other social scientists from around the world, about the ways that the behavioral and social sciences can help us better align our actions with public health expert recommendations. And then he and Sander will take our questions and hopefully engage in a conversation among themselves as well about decision-making in the context of COVID-19. So welcome to you both very much. Before starting, let me say to our audience, if you have a question, please just write it in the chat, and I will make sure and field to our speakers as many questions as we possibly can find time with. So welcome to you both. Thank you so much for being here, and Jamie, take it away.
Thank you, please, Ariel and Klaus, for having us and supporting this very important seminar that's been going on weekly. And so it's a really important endeavor, and we appreciate being included. And so, as Annalise said, this is a project. The title is Using Social and Behavioral Science to Support COVID-19 Pandemic Response. And it comes out of a paper that was an interesting collaboration between actually more than 30 social scientists from around the world. And we kind of all quickly got together and decided to ask the question of what do the social and behavioral sciences have to say about the optimal ways to respond to COVID-19. And so we somehow produced a paper, and the paper is now forthcoming in the journal Nature Human Behavior, for those of you who want to read more about it later on. And so that's the basis of what I'm going to be talking about today, is things that came out of that paper. And so as everybody knows, we're in the middle of a pandemic that has massive global health implications, and most people have probably seen graphs such as this, looking at the spread of the virus. And you can see the hot spots that everybody has talked about, but perhaps even more telling is that it's impossible to find anywhere in the world that has not been affected. Every country in the world has been affected. So you can even look at Greenland, and you see there are 11 cases in Greenland. And so this is a truly global crisis that's been going on. When we think about the qualities of the pandemic, it's important to think about what are the qualities. If we want to think about how to address it, we have to think about what we're trying to address. And one is it's global. And so as I just said, there's no part of the world that's not being affected by this. Another is that it's a very clever pandemic. It spreads in very unique ways that are hard to characterize sometimes. We think we can characterize them, but we're not always right in characterizing them. The growth of the pandemic is exponential, as we've all experienced. It's growing it has been growing at an exceedingly fast rate. And there is a dominant strategy, though. That is that there is a clear best strategy, and that is to slow the rate of diffusion. And so, and the importance of slowing the rate of diffusion is very clear. I'm sure everybody has seen graphs such as this, where the goal is to help flatten the curve. And the reason that we want to flatten the curve is because at some point, if the number of cases exceed the healthcare system capacity, then we're in a virtually impossible situation. And so that's the goal of trying to flatten the curve. And sometimes people forget about why we're trying to flatten the curve, but we need to flatten the curve simply because of capacity, and that requires some kind of collective response. And so when we think about what that collective response can look like, that's what we're going to talk about. But I wanted to take a slight aside, a tangential aside, because it's quite interesting. And as I'm sure everybody knows, the last pandemic was a little bit more than 100 years ago, the Spanish flu. And there was a paper written shortly after this pandemic, and it came out in the journal Science, which is the preeminent science publication, about lessons from the Spanish flu. And the paper argued that three main factors stand in the way of stopping the spread. And we can look today, and these are really the three main factors that are challenging us today. One is people do not appreciate the risks that they run. Two is it goes against human nature for people to shut themselves up in rigid isolation as a means of protecting others. And three, people often unconsciously act as a continuing danger to themselves and others. And so our starting point in putting this paper together was, well, we're 100 years later, almost exactly 100 years later. What does social science have to say 100 years later in trying to address these kind of challenges to addressing the pandemic? And so what I'm going to talk about in kind of the outline of the paper is we talk about the role of government. Of course, government can't be the only source to help stem the spread. So we talk about the role of organizations. And then we talk about four critical challenges: awareness, compliance, mental health effects, and then a variety of negative side effects or negative externalities that come from the pandemic. And so government can be a very effective actor. And as we've all seen, they've engaged in lockdowns with the idea of flattening the curve. And in doing that, they also need to produce needed resources. And so we're starting to see people now discuss when we send people out, we have to do that with masks, modified behaviors, and so on and so forth. And so government plays that role, and they've done so. And this is a graph. It's a simulation of what would happen if we have a tight culture, meaning a very efficient government. That is where the government engages in very strong measures to lock down. Moderate culture, where it's fairly mixed efficiency, and a loose culture. And the simulation suggests, so the y-axis of the graph is just the infection rate per million of people, and the x-axis is the number of days. And what you can see is that if you have a loose culture, you're going to see a much higher rate of infection. And so this kind of really accentuates the importance of government stepping in and taking a role in trying to slow the rate of infection by having things like stay-at-home orders. And so we kind of see that both in simulations and, of course, in real-world behaviors, which I'll talk about in a moment. And initially, if we look at this comparatively, the virus was actually initially uniquely bad in the U.S. by some counts. And so this is simply a graph of the first 30 days after a country surpassed 500 cases. So how well did governments respond after they cleared the 500 cases? And what you can see is from this graph, it's a little deceiving, which I'll talk about in a moment. But from this graph, the U.S. was uniquely bad, even worse than Spain and Italy, and China, which are the countries that seem to get most of the negative press in terms of their reactions. But the U.S., had they acted earlier, we could have kind of flattened some of the cases. And we see that's a lot of the political debate going on right now. The caveat, of course, is that we have to also think of this in a per capita perspective. And when you think of it from a per capita perspective, the U.S. Looks a little bit better than Spain and Italy, but we still see that the government was unable to, and we all know that the government was unable to really act quickly enough to flatten the curve as much as we'd like. And the U.S. kind of looks similar to Germany and France. The United Kingdom seemed to have acted a little bit more strongly in that sense. But there's a question, so did the government actions, what effects did they have? And there's fairly clear evidence, and I guess we're all seeing this in the last few days of evidence, because the places that had stronger orders are starting to reach the peak and starting to see a decline a little bit. The evidence that I put up here is a little bit different. This is just data looking at the change in distance travel. So it's very interesting data. It's data that's taken from people's phones, and it's looking at the amount that they travel tracked by their phones. And we can compare on the top part of the graph are counties with stay-at-home orders. This was by March 27th. And at the bottom half, we look at counties without stay-at-home orders. And we can see that the decline, so as you move to the left, that's less travel. And you can see that the counties with stay-at-home orders, you saw substantially less travel going on in those counties. So this graph really accentuates, aside from what we might see from the actual number of cases or the number of deaths, that there actually was a clear effect on the distance traveled in counties that took action a little bit sooner. But, and I'm going to come back to this a little bit later on, we also see dramatic heterogeneity through the country. So what this graph shows is that same data set, which is called safe graph visits. And this is traveling to points of interest. And points of interest are restaurants or stores or other things like that. And it tracks the percentage of people who decline going to these points of interest. And so the red bars are places that decline the least over the last week, and the blue bars are the places that decline the most. And what you can see is substantial heterogeneity, at least within the United States. The data were only available to me in the United States, and so that's why this graph just shows the United States. I'm going to come back to this graph later in the presentation to talk about what are the sources of that heterogeneity going on. So government can play some role. There's some evidence that governments, that local and state governments and counties that did take action certainly had an effect, but they can't do it on their own. And this has been an interesting thing from a political science perspective, because you have to then turn to the private sphere. And what you've seen is a variety of private organizations getting involved to help stem the spread of the pandemic. And so we're seeing this where government actions are weak and compliance is largely not really effective. We're also dealing with a variety of places where there are individualistic cultures, which I'll talk more about in a moment. We're also seeing organizations need to take action in less infected areas because governments are acting less, and also in places where there are weak healthcare systems. And so one interesting question, and this is something that came out of some data that Sander was involved collecting, is they did a cross-national survey asking, to what extent do you think it's important to do things for the benefit of others and society, even if they have some costs to you personally? And this was with reference to COVID specifically. And what you see is, so the light blue line, the highest, if you look at the highest on the scale, it was a 7-point scale, saying that it's very much important to do things for the benefit of others. You see Italy had by far the highest score there, followed by Spain and Mexico. In the United States, for a point of comparison, the modal response was 5. So you've seen some individualism popping out there, and that could be a problem in terms of getting the response to the pandemic, insofar as people might be less likely to do things for the benefit of others, which of course is essential to stop the spread of the pandemic. And so what we see is that organizations are going out of their comfort zones to take action and help slow the pandemic. And so we see a variety of things. General Motors producing ventilators, the New England Patriots for flying masks from China. The sports leagues are shutting down. We see rival biotech labs collaborating. And what we've seen as researchers is a radical change in research agendas, with researchers quickly changing their agendas to focus on kind of both medical and social and behavioral ways to help stem the pandemic. And so those are ways that organizations and individuals are trying to help stem the pandemic. And so why are they doing that? There's potentially high social benefits from an organizational or a consumer perspective. It can help social and political consumerism. And so some of these organizations might end up benefiting because they are taking steps to help slow the pandemic. There's an opportunity to influence other individuals and organizations, which is often an incentive. But one reminder is to be quick, but don't hurry. And by that, I mean that it's obviously time is of the essence, so we need to act quickly. But if you hurry too quickly, you might not be taking the right measures that are most effective. And that leads me to talk about the critical challenges. And that's where we have to really think about when we are taking steps and taking measures, and this can be from government or organizations or even ourselves as individuals. How do we address these critical challenges? And the challenges are really awareness of the pandemic, compliance with guidelines, mental health, and then there's a variety of negative side effects that I'll discuss as well. And these include unemployment, ethnic scapegoating, poverty, crime, and political instability. And so when we talk about awareness and cooperation, what we see is high absolute levels across the globe, but we also see important deficits. So we see important deficits cross-nationally. Some countries have better awareness and cooperation. Some countries, especially developing countries, are unable to have high compliance simply because of the impoverished situations that they're living in. They are unable to keep 6 feet apart. We see lower compliance in rural areas. In the U.S., we see lower compliance in the South. There tends to be lower compliance among young. There's a gendered aspects to lower compliance, and there's a political aspect that I'll talk about in a little bit. And in terms of awareness, this is another from the same data set that I mentioned before that Sandra was involved with collecting. And this just asks, how much do you feel you understand the government's strategy to deal with the COVID-19 pandemic? And again, you see that, you know, so Germany citizens understood that the most. The U.S. is kind of, again, giving a modal response of 5. And so what you see is a lot of heterogeneity in the response. Given the amount of press coverage and discussion that's been going on, you can see that people are still not feeling that they fully understand the government strategy to deal with the COVID-19 pandemic. And that's really cross-nationally with the possible exception of Germany, where there seems to be higher understanding, which is an interesting finding, given Germany seems to have a lower rate of infection and have lower death toll. So I don't really know the specifics of what's been going on in Germany, but this is consistent with what we see on the ground in terms of objective data and in terms of what the public is thinking. They seem to have a better understanding of what is going on there. And so what can we do in terms of helping awareness? And one thing that's clear here is increasing the prominence of credible sources and content, especially sources trusted by low compliance populations. So we have to think about particularly vulnerable populations. Who are credible sources for those populations? The other thing we have to do is really decrease the prominence of conspiracy theories, fake news, and misinformation. And I think we're all aware of the possible harms that could do to health. And here, smaller interventions can make a big difference, because what we know are there are things called super spreaders where misinformation can really spread very quickly, and I'll give an example of that on the next slide. But the way we want to do this is something called inoculation theory, which Sandra can talk about in more detail in the Q&A if people want to know, because she's an expert in this area. But trying to prepare people for misinformation and ensure they have accurate information and counter-argument. An example of this, I'm going to skip to the example of this, is this is something some people may have heard of this because this went viral pretty quickly, that there was a Belgian-Dutch study, why in times of COVID-19 you should not walk, run, bike close behind each other. And so this is a study that came out very quickly. A lot of people were citing it. I got a lot of people emailing it to myself. And the basis of the study was 6 feet was not sufficient. And so we need to stay more than 6 feet from one another. And this was getting a lot of attention. And the issue is that we need, if you look more closely, and this eventually I think came out, but if you look more closely, look at the source. So this was published on Medium, which is a outlet that the founder of Twitter started, and it's a place for people to post things longer than tweets, information. But what you see there is anyone can publish on Medium per our policies, but we don't fact check every story. So immediately that's a warning point, which kind of got lost in the viral spreading of that article. And then if you look at kind of what the authors of the article said, right, who were citing a scientific study that showed that, you could find a little note, right? I highlighted this. This was note 2 in the article, and then I put red circles around the important points, is that they're going to later submit the article for peer review. They decided it would be unethical to keep the results from the public during these times. And this raises kind of an interesting ethical question to which I don't know the answer, but it comes back to the point about being be quick but don't hurry. You do want to make sure that findings are getting out there as quickly as possible, and I think at least in the United States, I know that the National Science Foundations and other entities have really facilitated rapid response in terms of getting research out there, but doing it in a rigorous way. And so I think one warning is we're seeing a proliferation of scientific claims being made, and people need to be careful to look for the basis of that scientific research and kind of how it was vetted and how it was done, or else you end up with things like this Medium story, which spread fairly quickly and was really, it was actually based on simulation, so it wasn't even based on actual data collected from people. And so this is a case where you just have to be very careful about the spread of misinformation and try to look for the source. Is it a trusted source? And how did that, if it's claiming to be a scientific study, what do they mean by being a scientific study? There are certain norms to being a scientific study, one of which is peer review. So let me talk about compliance a little bit. So especially when we talk about physical distancing and staying at home, we want to amplify persuasive messages. And so as I mentioned, it's very important to try to get those from trusted sources. In the U.S., that varies greatly, and not surprisingly, that works best when it's from a bipartisan message. And those have come and gone in the U.S. at least insofar. But when there are bipartisan possibilities for messaging, they're going to be the most effective, and that's fairly clear from research not directly on COVID, COVID-19, but a whole host of other issues. When you get bipartisan support, you're going to get much greater persuasion. And then you can ask about what type of message in terms of content would be most persuasive. And a lot of people have gone into studying this, and one that I'll talk about because it's quite compelling is one of the co-authors on the paper, Rob Willer, who's a sociologist from Stanford. They tested 24 persuasive messages. And what they found was that, I'll skip to the ones that were most persuasive because that's really the interesting things, are ones that emphasize reciprocity, story of a specific young victim, and messages that explain dynamics of virility, breaking the transmission chain. So for example, so they tested 24 messages, and across varied populations, these three were the ones that seemed to really get people to be more compliant and accepting of stay-at-home orders and social distancing measures and so on and so forth. And so this would be an example of a reciprocity message. Doctors, nurses, and other healthcare workers are working around the clock, risking their lives to care for patients with coronavirus, working long hours in highly infectious environments. Many of them are falling ill. As our healthcare workers put their lives on the line, we do our part simply by staying at home. So kind of that reciprocity emphasis really led people to be more receptive to staying at home. Another example would be the transmission chain. On average, each person passes the coronavirus to 2 to 3 people, who then pass it on to more people, and so on. If you break the chain of transmission, you can single-handedly save lives and prevent the suffering of potentially dozens of people. Stay at home as much as you can and break the transmission chain. So again, out of the 24 message, these two and then one that emphasizing young victims were the ones that really seem most effective. So in communicating that, and this might change as the dynamics change, but it's very important to think about the content of the message that's being relayed. So the lessons on messaging are identify sources that are credible to different audiences, and build a shared sense of identity by addressing the public in collective terms, urging people to act for the common good and appreciate the reciprocity that's involved. And I think the reciprocity, again, is a key aspect in the situation that we're in right now. Let me briefly talk about mental health. I'm certainly no expert on mental health, but there are some obvious things to talk about. It's a perfect storm for a mental health crisis, of course. I think most everybody has seen the unemployment figures from around the world. This is just one from the United States. It's a graph that probably many of you have seen. And just the number of unemployment claims in the last week and the last 2 weeks have just skyrocketed beyond anything that we've ever seen before. And so along with unemployment, we're also seeing a loss of social support, uncertainty, anxiety. There's an expected increase in society's deaths of despair. And there's going to be important physical health consequences in terms of sleep, immune systems, and so on and so forth. So a few things we can do here is the term social distancing actually is an unfortunate term. And historically, as a historical side note, the term social distancing actually was a term coined in 1923, I believe, by a social psychologist to talk about intergroup prejudice insofar as we want to keep our social distance from groups we don't like. So this term social distance actually has an ironic history. And ideally, we'd be talking about physical distancing, right? Because we are trying to actually have social engagement by doing things like these seminars. And I'm sure everybody has kind of done these virtual engagements, which are social interactions. And so we should try to change the language to talk more about physical rather than social distancing. We also need to have mental and physical health tracking to facilitate the allocation of resources. We also, and this is coming back again to be quick but don't hurry, is that there is an optimal fear level. So people are going to be fearful. And that's a natural response, but we have to kind of monitor when it becomes non-optimal. Facilitate positive interactions, connection with others, coming back to the social interaction component. Provide exemplars of coping and cooperation, and then be on the lookout for suicide contagion, which I think a lot of mental health experts are expecting to kind of begin possibly in the coming months. And finally, let me briefly talk about a few other negative side effects, and then I'll finish up and then open up for questions. One is ethnic scapegoating, and so we can expect ethnic scapegoating to occur kind of everywhere in the world. There's already evidence of this in Indonesia, Western Europe, the United States, and so this is something that is going to go on, and we can expect it, and it's something that we need to address. Domestic violence, unfortunately, at least in the U.S., I was unable to find data on worldwide, but in the U.S., domestic violence calls are up in most cities. For example, in Houston, it's up 20%. 18% in Charlotte. The National Domestic Violence Hotline reported 1,700 calls in late March that explicitly pointed to COVID-19 as the abusive partner leveraging COVID-19 to further isolate, coerce, or increase fear in the relationship. So that's another obvious negative consequence that we need to be on the lookout for. And then polarization, and this is an area that is particularly interesting to me as a political scientist. And one thing that we're worried about is actually a lot of the depolarizing interactions that we have, that is people from different parties interacting enough, that's more likely to happen offline than online, because people have a tendency to interact only with people from their own party online. And so the physical distancing measures in place are going to limit the amount of those offline interactions. And so we need to look for interventions to reduce political animosity. And so coming back to the graph I showed you before, so the top graph is what I had put on before, which was the change in safe graph visits. And remember, I had said that there's a lot of heterogeneity around the United States in terms of people who are reducing their travel. The red spots, again, are the areas where there has been the least increase in in travel times. And if you map that on the bottom graph, which is Republican vote shares by county, you see a very close match. So on its face, it looks like this is somewhat of a partisan issue. And this has been a very popular conversation, at least amongst political scientists and a little bit in the media in terms of the partisan slant in the United States about this. And we can look at some graphs. I'm going to come back, though, in a second to challenge this a little bit. But initially, if we look through March and kind of the beginning of April, these are just graphs. I'm sorry, they're a little hard to read, but the blue line are Democrats, and these are national surveys that were done. The blue line is Democrats, and the red line are Republicans, and the top graph is concern. You see Democrats are expressing more concern. The panel B is behavioral change. You see Democrats were saying that they were engaging in more behavioral change. Panel C is avoiding public places. Again, you see Democrats doing more of that, and the same with avoiding small gatherings. So initially, at least through the month of March, you saw that this looked like a political polarization going on. And another interesting graph was, this was a graph from early March, and it was the amount of Google searches for hand sanitizer. And the y-axis is the relative search volume looking for hand sanitizer, and the x-axis is the proportion of the market voting for Trump in 2016. So it's actually this remarkable relationship, right? As the market in which the searches were going on are more Trump, you see fewer searches for hand sanitizer. But here's where I'm going to come back and circle back to everything I've just said. This was from early March, and all the data I just sent you or presented before was only through the end of March, and we're already now at April 14th. So ways to address polarization: highlight common identity with individuals all facing the same risk, bipartisan support, which I already mentioned, and then very importantly, and I think this is going to be the crucial thing as we move forward, especially in the United States where we are seeing this divide, is correct misperceptions of the other side, which often drives polarization. Right, the graphs that I just showed you in the conversations of Republicans and Democrats acting differently can be easily used as you start to then scapegoat Republicans aren't taking the steps needed or Democrats are overreacting. But let me show you the graph for hand sanitizer searches even by the end of March. And so what you see there is actually there's no longer a relationship. So the relative search volume flattened by March 20th. So this was even before a lot of states had put stay-at-home orders. And political scientists, including myself, are in the middle of ongoing data collections to track this political polarization. And the reality is that it's probably going to go up and down. But the most recent data is that there is less divide by party than there initially was. And I think it's important for people to kind of keep in mind that this is not a partisan issue per se. And a lot of the initial partisan discord was really geographically driven more than partisan driven. So if I went back to the graphs, which I'm not going to do, a lot of the counties that voted for Trump and also were not showing a lot of change in their travel distances were rural counties. And so you see this kind of perfect confound on kind of support for Trump and Republican and rural counties. So whether that was a partisan effect or a geographic effect remains unclear. And so I think it's important to not jump to partisan conclusions, because that leads to partisan bickering and inefficient solutions to the problem. And so I'll just conclude with 5 concrete paper that I began talking about at the start was promote accurate health information from diverse and trusted sources, apply techniques for reducing misinformation and accurate COVID news, promote persuasive videos from diverse trusted sources, encouraging physical distancing, and intervene to minimize ethnic scapegoating, and correct misperceptions of what others might be doing. And so those are the kind of the bottom line that we concluded the paper, and I will finish with that. And I think I'll speak on behalf of Sander that we welcome any questions that people might have. So thank you very much again for your time and interest.
Thank you so much, Jamie. That was fantastic. So much to talk about here. Before we start, I just want to ask whether Sander has anything he'd like to add, or Sander, do you have any other comments or thoughts you want to throw out there before we open it up to questions?
No, that was fantastic. I mean, I completely agree with the points Jamie's raised. So I'd be happy to open it up to the audience and let people ask questions and have a discussion.
Okay, great. We've got lots of different kinds of questions. Some more practical and some more academic about your data. So maybe I'll start with the data question. Somebody wants to know an argument about a possible correlation between geographical locations, kind of culture / political orientation, and compliance. How do you factor in the fact that it just is not as dangerous to venture out of your house in Wyoming as it is in New York City? Whoops, we can't hear you, Jamie. Could you click? We can't hear you.
Can you hear me now?
Yeah.
Yeah, thank you. So I think that question put it better than I was trying to put it at the end, insofar as I think that's exactly right, insofar as those data are not controlling for geography. They're simply descriptive data that are looking at geographic movements and then tracking them simply onto the Republican vote share. So in terms of the geographic data, I do think that's a source of a misperception, because those geographic data were getting a lot of attention in some media outlets, leading people to think there's a partisan divide. And so I think those are exactly the types of things that we need to factor in, and think that this is a heterogeneous experience for lots of different people, and it might be less partisan than a lot of people are attributing it to be.
Okay, great, thanks. What about, so you talked a lot about what messages to emphasize, super interesting. What about the media of the messages? So a lot of what is underlying this is a switch from face-to-face media communications to online communications. Do you guys have any recommendations about what kind of media to use, whether it's TV or online, or what online media would be more effective? Which ones seem to reach the widest number of folks?
That's a great question. I mean, interesting trend has been this has been a boom for the major news networks. Actually, their ratings have gone up to levels that have been unseen in the cable news era. And so people, at least initially, were turning more to mainline media, ABC, NBC, and in the U.S. at least, and CBS News. It's a really interesting question how long that's going to change, and kind of what are the effects of those news outlets versus watching the news conferences that are put on daily by the administration or by state government versus online sources. And I don't have any data or knowledge of the trends going on that, but I think that question gets directly at the point that I was raising, that there's a concern that the lack of physical interactions, that people do have a tendency, this is debated, but there are some who suggest that people do go into echo chambers when they are trying to get a lot of information online, and so there is a concern that that could happen. So it was a little bit, it was actually quite positive for many of us that the news networks were initially getting a large share of the watchers. I don't know how long that will continue, and when people will start to kind of just go into their sources, internet sources, and whether they will change their search behaviors in that sense.
Interesting.
So it's a great question, and it's a hard thing to study. It gets at a larger issue in terms of academic and private partnerships, insofar as the Google and Facebook have all these proprietary. They can answer that question quite clearly. And so, yeah, I appreciate the question.
And fascinating that you show such a difference in the early March to late March Google searches around hand sanitizer. What, as a social scientist, would you look for if you wanted to, what would be the indicia that maybe we're becoming less polarized, that we're seeing some and a greater degree of, kind of common values around all of this? Is there anything to suggest, or is it too early to have?
Yeah, I think there is. So the data I put up, so aside from the hand sanitizer data and the geography data, those graphs I put up that looked at the partisan spreads, those were collected around April 8th or 9th. And the people who collected those data are now in the field, and their preliminary data are showing that those spreads are even reducing even more. So I think the data that's being collected in real time is showing a less and less partisan divide. But what I would anticipate would be, as soon as, and we're starting to talk about when we're going to lift stay-at-home orders, at least in this country, and maybe Sandra can speak a little bit to what's happening globally, because I'm less aware of the public policy debates going on. But as a lot of you probably saw today, right, our Trump's news conference yesterday, he was asserting that he was the one who could decide when the stay-at-home orders, and several governors then responded that they will decide. But we're starting to move into this conversation, and we might see a repolarization. So right now, I think we're at about the least polarized that we might be on this. But as we start to talk about public policy changes, we might repolarize, which would be unfortunate. But I don't know, Sandra, not to put you on the spot and ask the question, but what are the political trends, any, that you've seen in the UK?
Yeah, the data we've been tracking, and we've done surveys in the U.S., in the U.K., in Australia, Asia, Latin America, and parts of Europe. And you definitely see most polarization in the United States on measures of government response, effectiveness, understanding of the problem, risk perception. So the U.S. does stand out. I suspect that it's decreasing now, but the interesting is that the second, probably the second most polarized is the UK, followed by Australia. So it's really Anglo-Saxon countries, which is not an unusual pattern, as they tend to cluster together in their behavior on various issues like climate change and vaccinations and so on. But you see the greatest polarization in those countries. We've been running some models on how predictive that is for risk perception and action, and it seems that for other countries, politics is not that much of a predictive factor, but it is for the United States and some other countries. So that's quite interesting. And in terms of whether it's increasing or decreasing, we've just done some new surveys to follow up, so I don't have the answer on that yet. But it does clearly play an important role. Here in the United Kingdom, Boris Johnson, one thing we worry about is elite cues from, President Trump, Boris Johnson. Boris Johnson was just in the ICU, intensive care unit, with coronavirus, which in turn has sparked lots of debates. But I'd be curious to see if that leads to depolarization, that, it's clear that the virus affects anyone, regardless of your political identity, and that's the more important message.
Sander, following up on that, one of our questions is about Scandinavia. So interesting that Scandinavia has seen less stiff social distancing measures. Can you talk at all? I mean, we would have expected maybe more social cohesion there, more willingness to comply, easier to have strong social distancing policies. Do you have any thoughts about the different paths that Scandinavia is taking and why that's the case?
I can only speculate there. There's also a heterogeneity within Scandinavia, which is interesting and unexpected. So, for example, Denmark has been quite strict and has followed guidelines quite closely, where Sweden has been extremely laissez-faire with their social distancing. Not unique to Sweden, you see the same pattern in the Netherlands, for example. I'm Dutch originally, so I do have some cultural knowledge, and I found it very surprising, actually. I would have no good explanation for why they're being so relaxed about it. I think the two speculative answers are, one, their populations are relatively small, and they have, or at least they perceive to have, healthcare systems that are well equipped to deal with the projected number of cases, which might lead to decreased concern about the need for strict social distancing. The discussions around herd immunity are also still being discussed, and it is surprising that the herd immunity strategy is still being discussed in those countries, given that they're on the whole much more collectivistic than some of the other countries that we've seen act. So that's been surprising. I don't have a good explanation for why that is. In Asia, we've seen, in more collectivistic cultures, we've seen very different responses to some of these questions, some of these issues. So you would expect that these countries were following suit, but surprisingly, there's quite a bit of debate, even amongst those countries, about what the required course of action is. And I think it's an interesting point in itself. I think pros and cons here in the UK. It's been interesting. I think you could argue that there's been a benefit as we've observed other countries act, and in response, the UK shifted their strategy. So if that hadn't happened, who knows what would have happened. But on the other hand, the fact that countries can't seem to agree on what the best response is, both locally and globally, raises important questions about coordination.
So another question we have is about how do we go about persuading people to read media sources in the sophisticated way that you were asking people to read them, Jamie, to look at the sources and see what they're based on and so on. Is that something, are there any strategies for getting people to be more sophisticated consumers, say, in the middle of a crisis, or is that like a long-haul educational project that we have to start with in youth and just hope that we do better in the next crisis? Oops, we can't hear you, Jamie. Can you?
Yeah. Yeah, I think a little bit of both. Insofar as I think there are nudges that one can do insofar as at least trying to be encouraging people to be responsible when they share information online, so things don't go viral that are not protected. And I do know that some social media outlets do try to kind of put on warnings when information does not look as credible, and people should try to adhere to those types of warnings and think about if those work. I think there are longer-term solutions, but I also, am aware that some of the social media companies themselves, including Twitter, so this paper actually was also presented to Twitter to help them encourage thinking about steps that they might be able to take to kind of add ways to make sure accurate information is shared. So I think it's both. Just helping people stay aware of looking out where the source is from and what especially when things are claiming to be scientific studies, and then also longer-term institutional responses to that.
Interesting. Yeah, and that sort of feeds on, we've got a couple questions that go to the fact that we arguably have some political leaders who seem to be, encouraging partisanship rather than discouraging partisanship around the world. And so what do we do in that environment? Is the strategy of your group to try to convince them of the dangers of that sort of approach? Is it to work more with private actors like Twitter as an alternative to try to tone down the impact of that leadership's message? What are your thoughts about that?
I guess my thoughts, at least in the United States, are and it's hard to know how to get around this. You're not going to really be able to work with some of the partisan leaders, particularly in the United States, entering an election year. That's probably a foolhardy thing to imagine. is to the extent possible, working with journalists and trying to work with people to make clear that how the partisan leaders are acting are not always reflective of how the citizens who might identify with those parties are acting. So one thing that's very clear, and I mentioned this briefly, but it's clearer in general, is people have vast misperceptions of the other partisans from the other side. And so, for example, in this country, the modal Democrat perceives the modal Republican to be earning over $250,000 a year. And the modal Republican thinks that that something like 35% of Democrats are in unions when it's like 2%. People have really vast misperceptions of the other side, and that was kind of what I was getting at in terms of misperceptions of COVID response. And so to the extent that you can kind of encourage journalists, and when us as academics talk about dynamics that are going on, which I tried to do a little bit here, is downplay the partisan conflict. It's a very alluring headline, but and it might be happening at the elite level, but try to draw a differentiation between the elite partisan bickering, which I'm less optimistic about addressing, versus what citizens on the ground are doing.
Fascinating. Very interesting. So, Sandra, we have a question for you. So, my colleague here, Dr. Beth Pardo, works with our students quite a bit, and she asks about this category of optimal fear, specifically with young people, college students, and we're very concerned about the way in which isolation and anxiety about the future might impact our student populations, and even the possibility there might be an increase in suicide rates in that group. Do you have any thoughts about messaging to young people in particular, and especially what we in the university context can do about it?
Yeah, that's a good question. So, a lot of people have been concerned about what the appropriate level of worry is for people in age categories that aren't necessarily impacted as much by the projected death rate of COVID-19. People have picked examples of where teenagers might be putting other people at risk by going out or not wearing masks and following the appropriate health guidelines and so on. And so it's an interesting question. I would say that I don't like the term fear. Fear, from a psychological perspective, fear is a maladaptive emotion, so it tends to paralyze people, whereas worry is an active emotional state that leads people to resolve it by taking adaptive action. So I think we should avoid scaring people and making them fearful, but people should be worried to the extent that they take appropriate action. And that sweet spot between having an appropriate level of worry and concern, but not being so fearful that you're starting to harm yourself or not do anything adaptive, I think it's really important. And how to message that is one thing we summarize in the paper about everything we know from the health literature, which says, don't send out fearful messages if you do not give people a reason on how they can mitigate the risk to them. And that's really the key thing. If you're going to put out a scary message, tell people what they can do to help mitigate that risk. So you might say, it's a very serious virus. It affects people of all ages. However, in those age ranges, you're less at risk. However, that doesn't mean that there's no risk, and here are the actions that you should be taking to reduce your risk and putting other people at risk. And I think that kind of balances an appropriate level of concern for people in that age category without making them fearful and spiraling negative emotions. We can revival too, get social spread of fear, which isn't good. And so that's I've been arguing to talk about worry instead of fear.
Very interesting. What about the level at which these messages, who the messages should come from? Jamie, I got the sense from one of your answers to an earlier question that you think more localized authors are better. Is that right, as opposed to national or international? Or what do you think about that?
Yeah, I think to the extent there is such heterogeneity in the experiences based on location, and particular populations, I think it's a time where local messaging can be quite effective. And in fact, in surveys so far, people are having a lot more confidence in the messages they're receiving from their state and local officials than from national officials. And that's across partisan lines as well. So that's a little bit trending towards local. I mean, the question is just how local do you get? But I think because there's such a physical aspect to this disease, to have people in your local communities messaging provides a sense of comfort and also a sense of credibility insofar as that you can really imagine that they're experiencing exactly what you're experiencing. They're in your community so that you know they know what you're experiencing. So I think that can really enhance the credibility. And I think a lot of local leaders have been quite active and stepped up to play a much more active role than they might otherwise have imagined playing in such a situation. So I think that could be quite effective.
Interesting. Yeah, actually, Sander, what about in Europe? I mean, in terms of messaging coming from the EU, are you getting a lot of messaging from the EU versus from national governments? And do you see any difference in how people respond to those?
Yeah, I think here in the UK we see less EU communication at the moment, given the Brexit situation. But which is unfortunate because as the British government missed several important EU meetings on the strategy because of their position. But I think in the EU people are seeing reliable messages from the EU. But people are very confused about conflicting messages from the government and World Health Organizations, at least in the US and the UK, where initially the government was diverging from the recommendations of the World Health Organization and the CDC, or the equivalent here in the UK, and that's led to a lot of confusion. So I think it is very important for people to pay attention to the advice of their local medical providers. So here it's the National Health Service, or it would be NIH in the US. And generally, people, what we've seen in our surveys, people are least trusting of information on social media, which is good because that's where most of the misinformation and the fake news is taking place, on social media. So it's good that people are downgrading trustworthiness of those kinds of sources, but hopefully people are putting their trust in credible medical organizations. Now, from the literature, we've got some good recommendations in our paper on how local leaders can be, beneficial. There were examples from the Ebola outbreak where local religious leaders were passing on scientific messages that are evidence-based from official institutions to try to get people to adhere to them. So those are interesting strategies. But of course, that doesn't work when your prime minister or your president is saying things that aren't congruent with the scientific consensus. So that can be a real challenge. As Jamie said, social media companies have taken interesting measures. If you go on YouTube, what's been very interesting is that they put below YouTube videos, they now put either, I'm in the UK, so I'm seeing messages from the NHS, but in the US, you'll probably see CDC. You'll see a label below YouTube redirecting you to CDC for credible information. But again, they don't necessarily partner with behavioral scientists to independently evaluate this. So one interesting concern is that they do the same with conspiracy videos. And so people might implicitly associate the CDC with some kind of conspiracy video because they see the label and think the CDC is promoting this. And so, I think these things are very delicate and they need to be tested. And that's one of the recommendations we make in the paper, is that it's so important to test these things.
Sandra, another question for you, kind of following up on something Jamie was talking about earlier. Can you talk a little bit about your work on inoculation and how that might help people navigate misinformation around COVID?
Yeah, so the inoculation research is really based around the vaccine, appropriately, the vaccine metaphor. So, by injecting people with a severely weakened dose of the types of misinformation they might encounter preemptively, and warning people about this might help build mental antibodies or resistance against infection with future fake news that people might be exposed to. We've done some research both in the lab where we do this, preemptively expose people to a weakened dose of what a fake news story might look like. And then we find that people are more resistant when they're later exposed to the real thing because they can identify it, they've had some time to spot the techniques, and we've developed that into gamified interventions. And we're working on a game about COVID-19 specifically, where it's a simulation engine where we take people through simulated weakened doses of the techniques that are being used to deceive people. One prominent technique is the fake health expert technique. So you prop up some fake expert to tell you that you need to drink lemon juice and gargle salt water, and then that will cure the virus. But we help people sort of spot the techniques so that they can then identify that fake expert strategy and all of the fake news that they're seeing and become more immune to it. So what we're trying to do is we look at what are the common strategies that are being used to deceive people on a range of these topics. Is it conspiracy? Is it fake expert? And then we find in these sort of tests that people become, full immunity. I would say it's like a real vaccine, right? But people become a little bit more immune to misinformation. But the key thing is severely weakened doses. And one of the missed opportunities I've been talking a lot with the UK government here is that there's more value in that metaphor when you do it preemptively. If we have preemptively protected the public from the types of fake news that would come out, which we can anticipate, in fact, because it follows a common story every time, then people would have been less impacted by it. And now we kind of have to do this retroactively, which it's good, but it's not as effective.
That is fascinating. So a lot of work to be done to prepare for the next crisis. Maybe, Jamie, the last question to you. I'm fascinated by the paper you started with from Science in 1920 and the fact that people were asking very similar questions. What would you say are the biggest leaps forward in your field in terms of that you see in comparing that paper to where we are today? What do we know now that we didn't know then?
Yeah, I do think so. Let's see if I can come back to that slide. Well, it doesn't seem to be working. I think we know a lot. They raise some of the issues, such as people are averse to kind of physical isolation, and now we know we have technological ways to connect people, and so I think just kind of from where we live today, we're in a better position to kind of address these things and kind of facilitate response. But then we also know things about misinformation and things such as what Sandra just talked about and how people are obtaining their information and kind of ways to ensure people are getting more credible information. So in some sense, you have to take the lessons from that paper and you kind of import them into the context that we're living in today, which is obviously a dramatically different mass communication and kind of communication context, which in some ways, if you stepped back, you would say this is even a recipe for more disaster because there's no kind of source that's checking this information. You can get kind of misinformation all over the place. But I think we know a variety of techniques to try to minimize that and things that we can encourage organizations and individuals and the research community to take steps to try to address those same challenges. So it's a great question because I think in some ways it's the same issues are alive, but we're living in this kind of viral environment, which is makes those challenges even greater. But we do know some things. So it was actually a very heartening experience to write this paper because you felt like the social and behavioral sciences had learned something over 100 years to address the environment that we're living in. And thinking about what are the negative side effects. Like the science paper didn't talk about things that are likely to follow, which at least we can be on the lookout for those negative consequences as we move forward and try to take steps to address them. And even having events like this, I think can be quite useful for people in thinking about the challenges.
Well, Amanda, we have to stop. I just want to thank you both so much for taking time to be here and also for the remarkable work you're doing, which is really important and transformative. And I know it's been really important for everyone participating on the call today to hear what you have to say. Thank you all for joining us for this webinar. You can expect a link to a survey coming your way soon. And so we want to know what else you'd be interested in hearing about. So please do respond and give us your suggestions. And don't forget to join us next week, Tuesday, April 21st, when we will host Northwestern Professor of Journalism, Stephen Thrasher, who's going to be comparing the COVID-19 outbreak with the HIV/AIDS epidemic on questions of governance, incarceration, and race. So that should be super interesting. Until then, please be well, stay healthy, and thank you to everyone for all they're doing to sustain our communities at these challenging times, and especially Jamie and Sandra. Thanks so much.
Thank you.